We're lucky today to have our patient back for a dermal filler procedure. She was the lady who received a Dysport treatment on our last episode. So we're going to go see our patient now.
All right, let's go.
Hey, Shauna.
Hey.
Great to see you.
Good seeing you.
You're back for filler.
Right.
All right. Well, I know you've had your lips done previously. How long ago was that?
Oh gosh, that was probably 5 or 6 years ago.
Okay. Were you happy with the result? Yes and no.
Yeah.
What didn't you like about it?
It hurt.
Oh, right.
I mean,
well,
painful, bad, painful.
so whomever did it did not do a block.
They numbed me nowhere. I mean, I was totally just like this, and it hurt.
That's terrible.
Hurt
That's
bad.
torture.
I know. I said I was not even going to do it again.
We're going to torture you, but not that much today.
Okay.
So I assume you had Juvederm or Restylane put in your lips back then?
It was Restylane.
Okay. I would suggest we do Juvederm. You know, they're fairly similar items, but I like the Juvederm a little bit better. It's a little bit silkier, and it's less likely to cause lumps and bumps than Restylane. And certainly in the lips, that's important.
Yeah.
You want your lips to be soft and beautiful.
Not bumpy, bumpy.
So we're also going to do your cheeks today as well. This whole under eye area right along the cheekbone.
Okay.
And we should be able to add a good amount of volume there, improve that whole area a little bit.
Okay.
So for the lips, we'll use Juvederm, and for the cheeks, we'll use the Radiesse.
Okay.
Now for the cheeks, you don't need a dental block,
Okay.
but as you know, for the lips, you definitely do.
I do.
So what we'll do is we'll go ahead and numb you up with a lidocaine, and let that be taking effect while we do your cheeks.
Got it.
Sound good?
That's good.
All right, well,
Okay.
I've got a couple of consent forms for you to sign, and then I want you to ask me any questions if you have any about what it says in there, and I'll go ahead and get your syringes of filler ready.
Okay.
Plush Medical Spa on Westgate in Dothan is excited to announce that we offer Thermage CPT skin tightening treatments for the face, neck, eyes, and body. Unlike older Thermage, the new Thermage CPT system allows patients to painlessly tighten loose skin in a single treatment session with no downtime. Tighten your neck and jowls or that tummy that was stretched by pregnancy with an immediate tightening effect that improves over the next 3 to 6 months. Call Plush Medical Spa today for your free consultation at 702-6869 or visit us online at plushmedspa.com.
It should be quite tolerable.
Okay.
So when I combine these two here, it's very easy to mix the items back and forth together.
So the numbing is going in the cheeks right here with the
filler.
Okay.
So that when the filler gets in there,
I see.
in about 30 seconds it will
Stop.
numb up the area, and it won't be
Okay.
uncomfortable at all. You're going to be surprised at how little injecting the cheeks hurts.
Okay.
Very little at all. All right, we'll go ahead and get you numbed up so that you can be getting numb while we do your cheeks, as we said. You're probably nervous. Everyone's nervous before filler, whether you've had it before or not.
Okay.
It's
Maybe
impossible
little,
not to
maybe
be.
little. Okay.
I mean, really, your brain knows that you're doing something that's a little bit out of the norm.
That you're having needles come
That
straight to your
needle,
face.
right, and then there's the whole dentist part of it with the block on the inside of the mouth. Nobody likes that, so
We're good.
we'll just get it over with pretty darn quickly, and then hopefully it will be all downhill from there, all right? So we'll go ahead and get you numbed up. Injection inside, and it's very uncomfortable. If I push it slowly, it's more comfortable, but then I'm in there longer, so I try to find some sort of middle ground. Your top lip should be going numb already. Doesn't take but a couple of seconds for that to happen. And then the lower lip is a little more difficult, but hopefully it will go numb by the time we start. Are you feeling the numbness up here already? Does it feel very strange, like you're about to trip over your lip?
It does.
That's usually what I hear from people. Trust me, your lip doesn't look any different than it did a few moments ago. All right, well, what we'll need to do first, of course, is clean your cheek area so that the skin we're going through is as absolutely clean as possible. Grab a couple of alcohol swabs here. We'll just start cleaning the area where the main injections are going to be. I tend to be a little bit more diligent about cleaning the cheek area because the injections are going in right along the bone. So below the muscle and certainly deeper than most of the dermal skin injections we do. So we want it to be as clean as possible to absolutely minimize any chance of an infection. And we've been quite lucky here. It's going to feel like I'm sticking my finger in your eye because I place my finger on the lower rim of the bone underneath your eye so that I will protect your eye and that there's no chance of us poking your eye or poking through the bone into your sinus or anything like that. What you may hear as I start injecting is a little bit of a popping or bubbling sound. That's usually caused by the outer layer of the bone making a little popping as the injection starts. Nothing to be worried about. I will take good care of you, my dear. So we'll go ahead and get started. I'm going to put my finger under your eye and we'll do your first injection to improve this whole area here. All right, so here's the finger in the eyeball and here's your first injection. You'll feel the poke, but once the material gets in there, it'll start to numb from within and you will feel significantly better. There's your first one. Can you feel it beginning to start to numb in this inside? Good. Here's my finger again. Here's your second injection.
I can hear it.
Did you hear the bubbling that time?
I did.
Yeah, that's why I tell people about it. I don't want them to be worried when they hear something while a needle is inside of them. That's never good to make someone worry. Now the Radiesse filler is so much thicker, more like a soft silly putty, that it's necessary to manipulate it and mold it into the exact shape you want it to be. Since we're doing bolus injections, meaning just small lumps right along the bone, we want to mold them together to make a nice uniform look. So we can see a big difference already. We've put most of the volume right in here and we will need to mold it, but I think we'll head over to the other side now and do some filling over there. So we're ready to do the second side. Be pretty quick and very similar to the first side. And we'll do the same thing with the finger underneath the eye. And here's your first injection. Doing all right?
I am.
Going a little bit quicker on this side because we're basically going to match what we did on the other side. This material is very, very moldable, and then because we're placing it right on top of the bone, it takes several weeks for your body to infiltrate it and basically lock it into place. So for a couple of weeks it will be quite soft and you want to be very careful with it. No sleeping on your stomach, no face down massages on a massage table. Even be very careful about sleeping on your side because it's very easy to roll over onto your stomach, and we certainly wouldn't want you to mush your new filler. It will be soft and moldable for a couple of weeks, so I tend to do most of my molding on your cheeks at our 1 week follow-up. That way you're not freshly traumatized from the needle and it's still soft enough that we can adjust what we need to do. I have a small amount left in the syringe and I kind of want to mold around on you a little bit first and then see what areas will do better with the last little bit. I'm going to come back around here. All right, we'll do a last injection right in this area and we'll be finished up. It should be pretty numb by now too.
Yeah, I don't feel it.
Now we just need to do a little bit of molding, and you will be good to go in that area, and we can move on to your lips. And I like to be able to do lips with a minimum number of holes. So while the needle is very, very thin, it's long enough so that I can reach the middle of your mouth from the side.
This is when you close your eyes.
Right, and it might be best to part your lips slightly during the whole procedure. That way we can better see exactly what I'm doing. And generally, when I'm doing a general fill on someone, I will fill the outer edge and then the body of the lip with a single hole. I never start at the very corner of the mouth. Doing that really overfills the edges and can give you that sausagey look. So it's very important to start at least a ½ centimeter in on the lip to do a really fine job. It's also best not to overfill, and best not to overfill this border especially, because you can get a very undesirable look. Okay, here we go. You feeling any of that? Good. Probably much less than the last time. Yeah. Right? The painful last time. So we do an injection along the border, and then I go into the main portion of the lip. Put some volume there as well. How's the bottom feeling? We're about to find out.
Yeah.
Okay, you let me know if you need more numbing. You may feel the initial poke, but after that you shouldn't feel anything. It doesn't even look like you felt the initial poke. Basically the same thing that we did on your right side, we're now going to do on your left. We'll go right up to the peak there. Nice Cupid's bow you have, Shauna. We don't want to harm that. We just want to enhance what you've got a little bit. Down into the body of the lip. Hey,
hi.
How are you?
I'm great. How are you?
I'm good.
Good.
So did you have a lot of bruising?
Just a little right here.
Uh-huh.
And a little bit right there.
I see that.
Yes. It only did it on this side. I don't know why.
Well, sometimes that's just the luck of the draw.
Okay.
So how are your cheeks feeling?
They feel good.
All right. Well, you noticed the difference, I assume.
I did.
And your lips look amazing.
I like my lips.
Oh my gosh,
I
they
like
look
my lips.
absolutely perfect.
Thanks.
Why don't I just pat myself on the back a little bit?
You can.
No, they look really good. It doesn't even look like you had any bruising in that area at all. Open up slightly for me and part your lips. Yeah, I mean, really, really good, my dear. Oh my gosh. Well, you're a superstar.
Yeah. Thanks.
All right, let me feel on your cheek filler a little bit. Lean back for me. Let me feel on this where the bottom edges are. I just like to feel on it, make sure it's nice and smooth and that it feels pretty even. I'm not going to push on you too hard since you've got that little bruise up there. Yeah, it feels good. It definitely improves the shape of your face and makes it very, very young looking to have some more volume right up in there.
So too. I love
Once that bruise is gone, it'll be perfect.
Thank you.
But yeah, just, I mean, I can tell you're trying to cover it up a little bit, but
Yeah, I am.
it looks like
Somebody hit me in the face.
just a little bit, not too bad. All right, very, very good.
Thank you.
Let me know if I can do anything else for you.
I will. Thanks.
Our next show will be about Thermage CPT skin tightening, a new painless way to tighten skin with radio frequency. And we should be here next week with all of that.
I can't wait for that.
It's new at Plush in January of this year. So we've been doing treatments for a little over a month and we've gotten some amazing results. You're going to want to see it.
Yeah, forget about going under a knife yet. Do this first. It'd be amazing.
We'll see you next time. Bye.
This has been Plush Tonight with Dr. Amanda Bell. Thanks for watching.